Well, welcome to our 2024 General Election Political Forum. Tonight we get to hear from candidates running for the proposed hospital district. Thanks everyone for attending. Thank you to the candidates who are joining us tonight, for the audience here in person, to the audience live on Facebook who's streaming it now or later. And thank you to all of the community members who sent questions. We got 40 plus questions for this forum, which is actually a record for any of the political forums we have. We always put it out on our website. We got quite a few this time, so thank you. I do want to say, for information about the proposed hospital district, please check out the Memorial Hospital of Carbon County page. They have quite a bit of information there. Tonight we're going to focus on candidates, but for more information on the district itself, visit the hospital's website and Facebook page. Some quick introductions. I'm Jennifer Moore. I'm the Director of Higher Ed. I will be your moderator this evening. Janet Garcia is running our Facebook Live. Thanks, Janet. And then Karen Webster is our Executive Assistant. She's in the back there. She's our timer. If our candidates would please pay some close attention to her, she'll let you know when you have 30 seconds left or when it's time to stop talking. And if you don't respond to her little cues, I'll verbally redirect you as well. So,
I can't read it.
Right. That's why they're color-coded. So before the candidates introduce themselves, I want to take just a moment to explain that there will be two separate groups of candidates to vote for. So Rod Wackerlin, Stephanie Chu, Vanessa Peterson, and Mark Kostovny are all running for 4-year terms. You'll get to vote for 2 of them. Mike Lujan, Jerry Steele, Gary Gorgon, and David Geyer are all running for 2-year terms. You'll get to vote for 3 of them. All board members who are elected will take office quite quickly if the district passes within 10 days by state statute. We do, yeah, surprise. So we have 3 candidates who indicated that they were not able to attend this evening. They're Gary Gorgon, Jerry Steele, and David Geyer. Dave did send in a statement, which I'm going to start with, and then we'll start with introductions of you guys. So David said, "Good evening, Carbon County. My name is David Geyer. I am running for a 2-year term on the proposed hospital district. I was born and raised in Carbon County. I've spent most of my career in healthcare fields, starting with being a medic in the Army. I moved back to Carbon County in 2007 and began working at Memorial Hospital of Carbon County in the ER as an EMT. I worked at the hospital for 14 years in both the ER and the OR. I'm currently the Carbon County Board Representee on the Central Wyoming Healthcare Coalition Board. I'm also a medical unit leader on fires. One of my goals is to make the hospital become a positive in the community. With my healthcare background, I would like to hopefully bring in some new ideas and fresh perspectives. I've seen firsthand and been involved with what good the hospital can do and has done. Thank you for your time." So again, that's from David Geyer. So with that, I am going to turn it over to our candidates who are here in person. You each are going to have 3 minutes to introduce yourselves. I did share this part with them ahead of time, so I just suggested that you touch on the following information in your introduction: the duties of the office you're running for, any experiences that you've had that prepare you to hold that office, as well as some of the main priorities and goals you have while serving in that office. Additionally, please tell us if you support the formation of the hospital district. And Rod, we're going to start with you.
Hey, thank you very much, Jennifer. Most know me, but those that don't, my name is Rod Wackerlin. I'm a Carbon County resident. I have been involved in healthcare my entire life. I grew up playing on the hospital grounds where the current hospital is now. I grew up a block away from there. I'm a licensed registered pharmacist. I practiced pharmacy in Carbon County for well over 45 years, owning many of my own stores. About 10 years ago, I was approached by county commissioners, several county commissioners, repeatedly asking me to serve on this board to help out with getting it going in the right direction. With some hesitancy, I finally caved in, and I've been there ever since. I'm actually serving on my 3rd term right now. Going forward, I hope everybody understands the duties of what we're looking for, the duties of where we are, what it takes to serve on this board. This is a big-time board. This is not for the faint of heart. Our meetings normally last between 6 and 8 hours, once a month, the minimum, maybe twice a month, plus we have a lot of other obligations going on. It is quite involved, and I can tell you the current board that is on there, that is serving right now, is very, very dedicated. The duties of that office are very complicated, very complex, but they do involve a lot of financial endeavors and a lot of learning going forward. I do support the hospital district, and I am running for this board because I believe in local health care. I do not want to see Memorial Hospital of Carbon County just become an entity for one of the larger units where all of our patients are shipped out for any procedures that may need done, and we're basically a glorified emergency room. Currently, Memorial Hospital of Carbon County does offer tremendous quality services, and I'd like to encourage all of you to vote for me. I think I have the expertise after sitting on that board for 10 years to help us go forward. And I can assure you that while maybe all decisions have not been made to your all liking or to my liking, we certainly have tried. With that said, I want to just kind of reissue the time that I've served on the board. I believe that some of the greatest accomplishments is what we have done right now, navigating this hospital through COVID and a computer conversion, which has been ungodly difficult. Thank you all very much.
Thank you, Rod. Stephanie?
So my name is Stephanie Chu. I'm a family practice physician. So I was running for the board because I've actually received a degree in healthcare administration. And so I have an MBA in healthcare administration. A lot of medical school, they don't really teach you about the business aspect. And I thought that was a really important part to kind of understand a lot of where billing cycle, revenue cycle kind of comes into play, and it really is a big part of it because, of course, you know, we all want to take care of people, but, you know, one of the sayings is one of the, I forget if she's Sisters of Mercy, but where I trained in residency, it was no margin, no mission. So, I mean, ultimately, you know, you want to help people, but if you can't pay your people and you can't keep your doors open, then, you know, you kind of need to reevaluate and kind of take a look at where you're at. So I don't support the formation of the hospital district. I feel like this is something that a lot of the residents that I've talked to, they have a lot of concerns about having more of our taxpayer money going towards a facility or entity that I don't feel like was very well planned out for this proposal. So it was pretty rushed. There was very little headway, very little notice. There weren't many people that were aware that the board, we were going to be voting at the same time that we were voting if the hospital district would be passed. So a lot of people I talked to, even if they felt like it was a necessary endeavor to take on, they really wanted more time to be able to kind of research candidates, research the issues, and I just feel like if it's something that does pass, I would like to see, you know, some new leadership in place. I would like to see some new decisions being made, things that maybe kind of bolster the hospital's financial aspect of things, as well as focus on patient care, because, you know, I have a clinic that I run, and I'm one of the people who people are going to come and complain to, good or bad. It might not be fair, it might not be accurate, but a lot of people will come and they tell me, here's what happened, and, you know, I try to pass along those concerns, I try to pass along things that happen, and sometimes, unfortunately, a lot of these things kind of fall on deaf ears. So with that, you know, I just feel like the fact that we run a financially solvent #1 clinic is a big part of that aspect, is that we intimately understand the revenue cycle. There's, you know, another person here that actually runs it with me. Vanessa Majors is actually our office manager, and so she also is very intimately involved into the billing side of things as well, and I think that's going to be a big part of where to start with to tackle some of the problems that are occurring in the hospital.
Okay, thank you. Vanessa?
Hi, my name is Vanessa. Like Dr. Chu was saying, so I do have some experience in the billing side, because that's what I dedicate right now. But I also hear a lot of the patients talk to us, good, bad. We hear a lot of feedback. But also with that in mind, I also am not for the district hospital at this time. I do feel like it is mismanaged at this time. So I feel like we gotta build the trust that we need to be able to bring clientele, to bring patients in, to bring the revenue that is needed back to the hospital. But it's gonna take time, dedication, and it's just gonna take a lot of trust. because a lot of the population does not trust the hospital at this time with fairness, but with changes and new leadership, they may be able to just come back and just try things out. It just all depends with the changes. But I am forward, I am willing to be devoted as far as time management, changing the policies, skills. I have worked with many different hospitals, and I have seen what has been successful for their side. And I can see, I freshly moved here in August of 2019, and I right away saw a lot of things that was not really good things. And so I would question myself, because I came from a different state. Is it a state thing? Is it here? What is it about? And so that is one of the reasons I left, because I used to work for MACC. That is one of the reasons I left. There was a lot of things that I did not feel that it was right comparing to other hospitals that were doing things. I have a little bit of experience as far as the personal side of things. My dad used to own a business. So when he became ill, I took over the business, and then he eventually passed away. But I took over last minute stuff all the way between like doing the payroll, doing accounting, doing lots of different things, communications. It was hard because I was barely 21, but it was something that I did successfully for a while there. And a lot of it, I'm the oldest of 5 siblings, so I think that a lot of that helped a lot with the motivation, with the skills to be able to be a leader. So I feel like I would be a good candidate. Like I said, mainly more than anything is just building the trust again. But that trust will happen again if there's new leadership changes. Regardless of who takes over, it's just the leadership changes is what is needed right this time. Thank you.
Thank you, Vanessa. Mark?
Good evening, and thank you for coming tonight. I'm glad to see you're interested in this. My name is Mark Gustavny, for those of you who don't know me. I'm a Pittsburgh native, but have been in Wyoming for the last 42 years. I have lived in Hanna for the last 32 years, so most of my life has been in Wyoming. I've been involved in healthcare ever since I moved to Carbon County in '91. I became a driver for Carbon County EMS back in '91. I helped form the Hanna ambulance service in '94, and then became an EMT in '97, became an intermediate in '98, and served on the Hanna service until 2008 when that service closed. I was very instrumental in forming of Schwemm's, what's there now to replace that. I was a board member of that. I was a founding member of that, helped put that service together, and served on that until 2018 when I retired from that. I'm still currently the fire chief in Hanna, so I'm still involved. My involvement with Schwemm's got me the opportunity to meet Commissioner Terry Wycombe. Mr. Wycombe convinced me that I had to serve on the hospital board to help at a time when it was struggling, and after multiple refusals, I finally gave in and did that, and enjoyed every second of it that I've been there. I've been there since 2009. I am certified by the Wyoming Hospital Association as a board member, having taken those classes twice because they redid their program. So I did the whole thing over again. So I have 2 little plaques put on the wall. I enjoy doing what I do, okay? I've done service my entire life. I worked for the gas company for 37 years. Service has been what I do, and that's what I continue trying to do while I'm on the hospital board. I've been to numerous education opportunities with that, gone through all of the programs that the management company had offered at the time. Just learning these things and just doing what I can. I understand. I'm one of the few people that actually took the time as a board member and went and sat in the business office. And how do you do this? And would hope to continue that. I think my education and my desire to do this has shown through over the last 15 years, and I would hope you would consider me for election for this. And yes, I do support the hospital district. I think it's very important for us to keep a well-managed facility in Carbon County. Thank you.
Thank you, Mark. And Mike?
Hi, good evening. I'm Mike Lujan. I'm the business owner of Michael's Big City Steakhouse. I've been responsible as the owner-operator of this restaurant for many, many moons. I've lived in Rollins since 1973, received my degree in business administration, followed by criminal justice, followed by psychology. And so here I am. I've had multiple experiences with many nonprofits, with boards, civil and church organizations, and in leadership and financial positions to help grow, recruit, and retain people, including Rollins Search and Rescue, St. Christopher's Highway, St. Joseph's Catholic Church, and South Central Wyoming EMS. Everything that I do in my life, I feel has been a calling. Now my calling is for this hospital and for this hospital district. A person very special to me once said, "I just want to fix our hospital." And that rings true because that's what we need to do. Going forward, I hope we can start with the clean slate, and given the opportunity to right the perceptions about the hospital, new leadership will bring a new vision with a new set of eyes. How do we change that perception? We need a doable business plan, long-term that is to be sustainable, but we need exact and short-term goals to get us there. We have to get there in order to make all that work. We know there's been problems, but if we get stuck in the marsh of all the old problems, we can't move forward, guys. We need to make sure the hospital is getting as much from the providers as we are giving them, and by 2025, there is a projection of a shortage of 78,000 RNs in the United States. It's expensive to provide health care in rural areas. We need to run this hospital like an efficient business, business that is financially sound, and equally as important, one that is there when we need them. So I encourage the voting residents of this county and these communities to please vote yes on this hospital district, to support our hospital, and to have faith and trust and believe that we're going to fix this. Thank you.
Thank you all for your introductions. We are now going to move on to the questions from the public. I mentioned this earlier, but we solicited those from our website and from Facebook. We received over 40 questions. We don't have time for all of them, so we've done our best to compile them in a way that encompasses the majority of them or the idea of them. After this forum, probably tomorrow, I'll actually email you all the questions, and I'm going to email them to the hospital as well, in case either of you want to speak to them separately outside of this. So for the remaining questions, each candidate has 2 minutes to respond to each question that's asked. After all responses are given, each candidate will have an optional 1-minute follow-up time. If you want that 1-minute follow-up time, please let me know, or we'll just move on. And we're going to rotate speaking order as well. So first question is about finances. Several of these have multiple questions as well within the one question, so if you need me to repeat, I'm happy to do that as well. So question number 1, Dr. Chu, we'll start with you for this one. A lot of residents feel like the hospital is poorly managed versus underfunded. What is your response to this? Additionally, what strategies do you propose for maintaining or improving the financial health of the hospital?
So I would agree with that. I mean, I think that's kind of the big thing with why I don't really support the hospital district. I think if it's a mismanagement issue, you're going to run into the same problem where you have the money coming in and it's still going to be not spent correctly. So in our hospital, unfortunately, we have a lot of problems where we're promoting people who aren't qualified for the positions that they hold, but they either know somebody, they've worked well in the current position they have. It's actually known as the Peter Principle, where you promote somebody just because they're doing well at that task, but don't realize that they maybe don't have managerial skills that are actually going to be beneficial for the position that they're actually going to be promoted to. So you see that a lot where we have a lot of supervisors, a lot of managers who maybe aren't the best manager to be in that position. And unfortunately, what I've seen a lot too is that when that person, if they don't work well, it fizzles out, they just transfer them to another position or they make a new position for them. So I've never seen a hospital of this size, and I've worked in a lot of rural hospitals. I've worked as a hospitalist in several different hospitals. I've never seen a hospital of this size have this many admin members. So there's a lot of people who unfortunately there's maybe not a 40-hour-a-week job that they're doing. There's some people who do a great job, and I really very strongly support their position, and I think that, you know, I've worked very closely with them to try to develop different things and different ideas, different lines. And so that is something that I think you really need to look at. Where are people pulling weight? You know, if you have 4 people sitting in a clinic that's supposed to be open, but there's no provider and they're getting paid and the doors are locked and no patients can walk in, that's kind of not a great management scenario. So I really feel like some of the strategies, number one, of course, billing. So it's really simple with money in, money out. So if the money that's coming in is not being billed appropriately, which unfortunately right now it's not. For example, you know, for me, I tried to make a call and I wasn't able to pay. So just wanted to point that out.
Thank you. Vanessa?
So as Dr. Chu was saying, there is a lot of issues, a lot of things that we hear about, like unknown positions that all of a sudden happens to be there just because communication, the whole friendship going on. So a lot of that does bring a lot of issues to where, okay, do they have dedication? Do they have the experience? Brings a lot of questions in place that makes you really wonder, okay, what is that person doing? Because we hear a lot of complaints, a lot of issues, that it just falls down to, again, management, the leadership skills that is not given appropriately, accordingly. There is, as far as the strategies, I'll say it's pretty easy. It's just getting hiring, opening positions to people that actually have the experience, to actually have the open, the education, the knowledge, be able to catch on quick, because this is a fast-moving healthcare. Healthcare is always fast-moving. There's always, you cannot stand just and do same things over and over and over for years. Everything changes, so there's like new things that's gonna come up, like new policies are needing, new something. It's just overall, it's just gonna be about all the changes.
Thank you. Mark?
I apologize. Could you repeat the question
sure.
for me, please?
So a lot of residents feel like the hospital is poorly managed versus underfunded. What is your response to this, and what strategies do you propose for maintaining or improving the financial health of the hospital district?
Okay, well, first, people have to understand what the role of the board is. The role of the board does not involve themselves in day-to-day operations. We hire one person. We hire the chief executive officer. Everyone else in the facility is hired by that person. So we don't know what the clerk in the clinic is doing. That's not our job. That's not where we're supposed to be. We operate the facility from a 10,000-foot level. Do I feel we have had the best management for all 15 years that I've been there? Absolutely not. Okay, but recruiting the best management to Carbon County, Wyoming is also not a easy task. Okay, in order to pay people the salaries that you would expect if you are a top-notch manager, can we afford to pay that in Carbon County, Wyoming? And that's why when you look at a 60-year-old building, it needs more maintenance than a new facility does. So that if I'm elected to this, I will promise you that monies that come from that tax will be spent on the building, maintenance of the building, and will be spent on acquisition of new equipment to build the facilities. It's not going to be spent on the payroll and things of that nature. And that's where I think we need to get, and it's why I support the district and why I'm still on the board. Thank you.
Thank you. Mike?
Thank you. You know, the board, whoever's on that board, needs to do its due diligence in regards to what the management company has done. We need to understand what it's doing well, equally what it's not doing well. We need to look into whether, as an option, if we truly need them or we need to look somewhere else. We need to look at all options. What do they bring to the table? With every management company, what do they offer? What do they bring to the table? What do we need at this time for our hospital? Maybe look at other options. We need to look at all the options and make someone a grant writer. We need to try to capture grants. I don't know if that's something that is in the works or has happened, but there's grants out there to retain people, to fund education, to fund those kinds of things, for giving back providers' salaries for their education, for rural hospitals. Does this hospital have more people than sustainable for the services and the revenues that are offered? I don't know, but we need to fight for the people to keep their jobs, to maintain this hospital. We need to fight for this hospital and try to make a difference in doing that. I am going to, if elected, make every administration accountable for every action that they take financially in this hospital. If elected as a board member, I will expect there to be accountability on all hospital operations. Each one of you should expect that. Thank you very much.
Thank you. And Rod?
Thank you. First and foremost, I can tell you, Mark hit the nail right on the head. The board's obligation to the hospital is to oversee at a 20,000 foot level. We hire and fire one person. That person is responsible. Although we do get drug in sometimes on the day-to-day operations and try to move things in a better direction. We've had some recent hiccups with the revenue cycle and the finances lately. That is directly related to our server conversion. We converted to a different computer system in September of 2022. That conversion did not go well. It created a lot of issues. We were down in the water for basically 8 months. There was wrong data entered into that conversion that created a lot of financial issues within the hospital. So we had to stop where we were, go fix where we needed to go, and then restart. That in itself created a major issue for the finances of MHCC. I do believe that we've made headway moving forward there. I do believe we have a much better team in the business office and the revenue cycle moving forward. We hired a new company called Revenue Enterprises that is going to help us recoup a lot of private pay that we were unable to bill for during that time. I hope that answers your questions, but I can tell you it has been at the forefront of every board member. We discuss it every meeting extensively, the finances of the hospital and where we are. The most important thing we can do going forward is to hire a permanent, very solid CFO to give us good, accurate data so that we all that sit on the board, whoever it is on that board, can make solid, good decisions and trust that data. That has not happened in the past. Thank you.
Thank you. Does anyone want a 1 minute follow-up?
I'm good.
Okay, go ahead.
So one question I do have then about the finances with the hospital, so you mentioned billing. So I saw a post about the billing and inviting us to call a number for the new revenue cycle person. I called the number, it didn't work, so it didn't go anywhere. I had to call the hospital. I was on hold for 10 minutes to try to make a payment. So I know how much I owe, at least for the partial payment, because it wasn't a clean bill submitted, so I still don't know if I owe more, but I got an explanation of benefits from that, and it was $78. I called after being on hold for 78 minutes, I got put on hold again. I couldn't make a payment because they said I don't show a balance, and my guess is what will happen is in 6 months I'll probably be sent to collections. So seeing on this letter that it was talking about billing and saying it's your responsibility to collect money for it, will you write off the amount that now private insurance won't pay for because it's been too long, because you can't bill them after 3 years?
Anyone want to? Oh, go
You want to
ahead.
answer that, Mark? You want me to?
No, go ahead.
Okay. First and foremost, my apologies. I know there's some hiccups in the transition that we've had going forward. I do believe that they are better today than they've been. I actually went online and paid my bill in 10 seconds a couple of weeks ago. I did not call. I just went on my portal, paid my bill, everything was done. It was a bill that I've owed for a year that I didn't know I owed, okay? So there are some hiccups there, and we're trying to get everything back on top of the game. I hope that kind of answers your questions. I don't know where else to go. As a board member, that isn't something that we would address. I might mention it to the CEO or the CFO, the finance director, and let them handle it. That's their job. I can't go talk to personnel. Thank you.
Anyone else want a 1 minute follow-up? No? Okay, we're gonna move on to the next question then. Vanessa, we're gonna start with you for this one. So, The hospital has discussed where the mill levy funds will go if the district passes. But you as candidates, if the district passes, where do you feel the mill levy funds should be directed? For example, expanded services, retention of quality providers, new equipment, the building, and how, wherever you feel it should be directed, how can the community be sure that the money will in fact go to those items?
Well, my question to that is, with all the debt that is going on, that how much debt the hospital is in, will there actually be money from the district as far as the tax paying? Because there's no guarantee, because there's so much debt going on, that money is just going to go one place to another to pay all the debt. Places like the EMR system, for example, just that alone is going to cost a lot just to keep going to that. So it's kind of difficult to answer that question, since I can just see everything being dragged on to the current debt that is going on, but to be able to get supplies, because supplies is hard to get right now as it is alone. So everything's just gonna go paying all the companies to be able to get all the supplies, equipment, things like that. Right now, there's no chance for luxury, to say per se, since everything's just gonna go to all the debt, unfortunately.
Okay, thank you. Mark?
With the formation of the hospital district, things change. Right now, currently, we cannot take a loan that we can't pay back within that budget year. We're restricted by that, so we can't go beyond that. With the hospital district, we have the opportunity to get a line of credit. We have the opportunity to take loans. We have the opportunity to do more financing, such as the business world does. You've heard me say it before, I will continue to say it, and I will say it always. I will pledge, if I'm elected to that board, that tax money will go to the building, and it will go to expanding new services, capital services, buying equipment.
Great, thank you. Mike?
So, thank you. It's an advantage for other board members to know what needs to be fixed and what needs to be done. We on the outside can only look in to see what we think needs to happen. If elected, I promise you that all of that will be looked at from a different angle, with different eyes. We all have to do that. Rural health is expensive. It's hard to recruit to rural hospitals. It's hard to recruit here. What does the community need the most? That's what we need to ask. It's better to do a few things very, very well than to offer a lot of services and not do them completely. With my people, in my business, and in my interactions, I expect a certain level. We need to achieve that. We need to achieve our customer expectations with everything that we do. And in order to do that, we have to have all the facts. We need to know where do we need to pay our light bill first? We need to pay for our food. What do we need to do first? And prioritize in that respect. I would like to be able to look at that and see and gather all that information to make the best qualified judgment on what we need to do. We know we need to fix a lot of things. Input from all of these forums with these questions says a lot about where we need to go in that direction. And I'm listening. Thank you very much.
Well, thank you. First and foremost, I'm in agreement with Mark. That mill levy should go to the upkeep of the hospital. Let me reiterate one thing. The way that we are structured right now, the county commissioners, which we get a little funding from, and thank you very much for what they do, but it isn't sufficient to take care of the maintenance of our hospital building, of which they own. State statutes 18.8-102 says commissioners are required to levy a sufficient tax on all taxable property of Carbon County to provide for the maintenance of the hospital, period. The amount to be is to be collected and set aside as the county memorial fund. That has not happened. And so for us to take care of an aging building to the tune of about $1.2 to $1.3, $1.4 million a year for the upkeep and maintenance of that money has had to come out of operations. So that is a very valid point. Now, the last thing I'm going to say is is I really feel like Mark is spot on with where those monies should go as far as the upkeep of an aging building. But that's going to be up to the new board to make that decision. So, thank you.
Thank you. And Dr. Chip?
So one point was that the mill levy, it was because the hospital had declined the mill levy since they would be able to get a higher amount per the budgeted year. So the fiscal year of 23-24, they actually budgeted for $240,000, where it would have been about $130,000 had they gone by the mill levy. And so that was from the county commissioners. They had informed me that. So it's something that they have fulfilled their obligatory duties. So in addition to that, I think right now, kind of, the point that, Vanessa was making is kind of tough because, I mean, we don't have like a cafeteria, we don't have a surgeon, well, maybe now, but, as of right now, I wasn't able to refer anybody over there, so really for the RNs, MDs, there's a lot of places we really need to put money, and there's a lot of debt right now. The EMR is an important one, so the minute that the EMR says we're not going to supply you anymore, if you owe them $1.8 million, that's not something you can just kind of come up with. I don't know if that number's current, I don't know if that's an old number, but with that, you can get into a lot of trouble with HIPAA violations, because if you do not send over records within 30 days of request, you actually get huge fines from the government, and that's not something that you can just say, oh, well, we don't have a working EMR system. They say that's too bad. I mean, there's a lot of liability that we're open up to by the amount of debt that we currently have. So that would be something that I would say in terms of oversight. I know that it's something where, they would like to kind of say, hey, we're kind of hands off the board, but then what are you responsible for? If you're not responsible for the overall functioning of the clinic, the overall functioning of the hospital, the staffing, the staff and kind of how the managers are, because that's kind of what you're seeing, then what is it that you do oversee? Because that's kind of the backbone of what makes a hospital and an organization successful.
Okay, thank you. Does anyone want a 1 minute follow-up on that one? All right, moving on to the next question. Mark, we're going to start with you. There's been a lot of discussion about transparency and trust of the hospital board, as well as comments that the current and past boards have been somewhat unapproachable. As a board member, how have you or how will you ensure financial transparency and accountability in managing public funds and gain the community's confidence in the board? If you're a current board member, what specifically, if anything, would you change moving forward?
Over the 16 years that I've been on the board, we've tried different things. We've had a suggestion box in the cafeteria that only a board member had a key to. So those questions came directly to us. We know for a fact over the years that different administrations have discouraged talking to the board. The nice thing about being in a small community, though, is people know their board members. People come and they talk to their board members. If you're unfortunate enough to attend some of these meetings, you would hear these questions are asked. These things are asked of the people that are there. I can't count the number of CEOs that have been there since I've got on the board, because it's going to take you 6 months to a year to see whether this person is actually doing their job. Because everything in healthcare, you build something today, it's 3 to 6 months before you get it back. You don't know what's going on, so you have some time in there. But we've fired an awful lot of people that weren't doing their job. We have been there, and up until February of 2020, we had $6 million in the bank. COVID killed us. We spent $4 million in 1 year on traveling nurses. That's what hurt us. We had a flood. I don't know how many of you remember the flood that shut the hospital down for almost 3 months. That's what put us behind. And we have a plan to get out of that debt that we know we are currently in. As I talked about, financing will change too with the formation of a district.
Thank you. Mike?
Hi, could you repeat
Yep,
that, please? Thank you.
Sure will. So there's been a lot of discussion about transparency and trust of the hospital board, as well as comments that the current and past boards have been somewhat unapproachable. As a board member, how have you or how will you ensure financial transparency and accountability in managing public funds and gain the community's confidence in the board?
Well, Mark, you spoke about the flooding in the hospital, and I can remember going up there at 2 o'clock in the morning and being part of that bucket brigade to help. And that's because I believe in that hospital and I believe in the people. It's not fair for me to be able to judge Mark or Jerry or any of the board members that have sat on the board or in the past about any, in regards to your question, anything that's happened. I wasn't privy to that. We all know what they're talking about. We all know what's in reference to. But that's not my place, nor would I ever disrespect any of these board members for the time and the efforts that they put in. Aside from that, we can all agree that billing is a problem. We can agree that it is the greatest problem. It's a challenge, and we need to answer to that. It's always been an issue. Why is it still an issue? Well, they've done in-house contract, they've used multiple companies, they still haven't met those expectations, but why? Billing, this is very important. Billing deficiencies outweigh all the good that this hospital does. Every bad review in regards to that affects what's happened in this hospital. It takes away from all the good things that they do in the mammograms. It takes away from everything that's done in the ER. They need to make sure that the pricing is competitive and more efficient with sending out itemized statements. We need to look at all the options, and we need to fight for this hospital. We need to fight for the people. We need to fight for the people to keep their jobs and to keep this going. Thank you.
Thank you. Rod?
Well, first and foremost, let me just kind of rebuke that a little bit. I don't know that anybody has been more transparent than myself. I'm everywhere all the time. Everybody knows me, my telephone number. I've had emails. I talk to everybody about the hospital all the time. I give them as candid and as straightforward as an answer as I possibly can. Obviously, there are some things that are not shareable. You can't talk about personnel. There's certain things that you cannot talk about, financial things when you're looking at property. Those have to be kept confidential. And so if that's where they're coming, then that's where it is. I can't speak for other board members, but I can tell you my door's always been open. Dr. Chu's talked to me, she's been to my house, has many other providers, has many other RNs, other folks, all the time. I can't give it any more than what I've given it as far as being transparent. So, thank you.
Dr. Chu?
And so I do feel like between Rod and Mark, it feels like there's a big disconnect between you feel like you're being transparent and then a lot of the community feels like there's a lack of transparency. So I feel like a lot of that is, being able to go out into the community and really asking, let's be honest, unfortunately, the people who are upset, because those are the people who are going to tell you most likely versus your friend who doesn't want to hurt your feelings. And really asking them kind of what they're talking about, what areas it is that they feel like there's not that transparency. Because even if you are 100% transparent and it's just the perception is reality. So if people feel like you're not being transparent, in their mind, it's already a done deal. There's a lot of things that we kind of talk about, like talking about traveling nurses. I mean, there's a lot of issues there where I have multiple nurses who say, hey, I want to work PRN, I want to work at the hospital. And they're turned down for some reason, whether it's they didn't get along with a doctor that was there or something like that. So, I mean, I think these are all areas that are great that as board members you can go out there, and when you hear these things that are, wow, that could be a big thing that we could save a lot of money on, you can go and bring to the CEO who you appointed and try to get some of that feedback, I mean, and just another point that this kind of comes with transparency is, like, when I was the medical director at the clinic, I filled out a rural healthcare clinic application. It took me hours. I mean, probably like 200 hours to do this application. It never got filed. That would be a great revenue source because that can increase the Medicare, Medicaid reimbursements by 20-25%. And it's not what the residents are paying. It would just be straight from the government. So I think there's a lot of things like this where we really need to take a hard look at all these different areas, meet with different people, managers, and see what are your biggest issues and be able to get a hold of, the problems that we're having right now.
Thank you. Vanessa?
So a lot of the transparency issue that I've noticed is more per se on the people side, on the community side. Like, yeah, not everyone's gonna go over to, for example, to his house or be able to call him in the afternoon or something, because there's no confidence there because they don't know him other than the name itself. So a lot of it that would help a lot with the people would be just like, okay, we have this going, this is what's going to happen, this is what's going on, but more open as far as word usage too. Because a lot of the words, of the things that I've noticed is there's a lot of the bigger words or repetition itself that makes one double question, like, okay, what is exactly that they're saying? What are they advertising to say? What is it going on? Is that number's actually gonna work? Or if I try that phone number? Because there's issues with phone numbers all the time too. Like, what is it gonna work? That's where, there's like a clear bubble to say, what is it? Like, everyone needs to be like on the same page versus, oh, this is one thing, this is the other thing, and then so that's when rumors starts to happen. And then now everybody's second guessing themselves, and what is one thing, what is the other thing? Should we trust this rumor? Should we trust that one? Because there's no transparency at that point.
Okay, thank you. Does anyone want 1 minute follow-up? Nope. Okay. We're going to take a little bit of a turn here to a different topic. Mike, we're going to start with you for this one, and there are a couple of questions in this. So, do you value the importance of culture within the hospital for employees? Do you feel that culture has an impact on the community and the success of the hospital? Additionally, what does culture mean to you, and how would you work to improve that at the hospital? Please feel free to address employee retention, turnover, and attitudes and policies that may affect culture.
So my question is for the question. What are they referring to as culture?
Well, the questions were anonymous and put on our website, but I guess I would say
Call them up and ask.
I mean, the culture within the hospital. How does that affect our community? How do you help improve the culture within the hospital for its staff, for its employees?
Understood, I think. Initially, that there has to be buy-in. There has to be a sense that you're not there for a paycheck, that you're there to make a difference. Every employee needs to be given the tools to be successful in every business, in every organization, in every place. And in order to be successful and given those tools are the ones that are going to be utilized to help the patients. The tools needed to help the patients. That's number one. Okay, so that culture, I can't ascertain that culture is what shape it's in. I can imagine that the people are wondering, that they're concerned. The employees are concerned. What's going to happen to our jobs? What's going to happen to this hospital? And I ask that we pose that question and find solutions. I pose that we try to make a difference, because if we fail, it's going to affect every employee of that hospital. Over 100 employees are going to be affected, and we can't allow that to happen. I can guarantee you the quality of care in this hospital is above average. I promise you, these people are working hard, and they're working hard for you, and I'm proud to be their friends.
Ron?
Thank you. First and foremost, culture is ungodly important. How you perceive when you first walk into a business, you pick up on that right away. I don't care if it's my pharmacy, Dr. Chu's business, Memorial Hospital of Carbon County, or our clinics, how you're dressed, how you're perceived, how you're talked to. It's ungodly important, and that rebounds everything. That is the most important part of any business, is your interaction with your patient or customer, period. We have wonderful people in that hospital. We have wonderful health care. I have not received a clinical complaint about anything that has happened in that hospital in over maybe 2.5 years. But I have had some complaints of some people, or not maybe addressing some of those patients properly at some points or times. As far as turnover goes, healthcare is notorious. You can't keep, there is just nothing stable about it. It is ever evolving in the healthcare world. It's not unique to MHCC. It's not unique to Wyoming, it's everywhere, you know, so that's where that issue lies, and you do the best you can. And I'm just gonna reiterate one very important thing. Carbon County is hard to recruit to. Rollins is really hard to recruit to. Having been in the healthcare industry for 45 years and tried to hire professional people for that period of time. So, thank you.
Thank you.
So I definitely value culture. I mean, I think everybody, you know, really should if they don't. But in terms of, do you support the culture? It depends. Is it a toxic work environment? Is it something where, you know, I had an MHCC employee tell me about one of her subordinates, you know, you can't fix stupid. That's something I view as pretty toxic. That was 4 years ago that happened, and I still remember that comment to this day because I was just shocked at how callous and how cruel of a statement that was. Just, you know, there's no place for that. And when you have an attitude like that, even if you don't tell that employee that is something that is going to be shown in your actions, in your words. And those are very toxic settings that people aren't happy in, and they're not going to thrive in, and they're not going to do well in. And that is, I feel like, the position of, you know, the board to make sure that the whole environment is not something where you're having toxic managers, you're having people who are quitting because they can't take another day being bullied and being harassed. So with turnover, I agree. I mean, turnover is inevitable. The question is how much turnover. So, you know, finding people and positions or building them up, training them up to specific skill sets, that's a really important part, is because I agree, it's hard to get people to come to Rollins. So you kind of build up the people that you do have and you train them for the roles that you really need, that they're well suited for. You know, and speaking with that, I did mention already, you know, some of the issues with kind of nursing. One of them is somebody told me, they were like, I retired and I said, hey, I'll come work for you PRN. And they said, we'll pay you less. And they said, well, that doesn't make sense. They were like, well, the benefit to you for being PRN is that you can work whenever you want. So even though I'm not paying benefits anymore, I'm going to pay you less. I mean, these are things that I know all of them sound like such little examples I'm bringing up, but it's because all of these little things combined, it's a huge amount that can sink a ship, you know? And these are just things that are overall, it's kind of this overarching theme that we need to listen to people.
Thank you. Vanessa.
I was actually in a personal matter. When I first started with working for the hospital at the clinic, it was right away coming in from a different state. I could tell the vibe, the difference. If you are not friends with the right people, they will make your life miserable. Like there would be like, they would talk behind each other's back. They would, yeah, it was awful. To one day, the only reason I tolerated was because I was working with a really good provider. I was assigned to work with Dr. Chu at the time, and this is how I met her. And that's the only reason I kept going. Because otherwise, I was ready to leave because it was very toxic. Like there was a lot of rumors talking just within staff itself, and that made things hard to work with. There's a lot, whether you're going to be worried, oh, what kind of day am I going to have today? Today's going to be like smooth day, or is today going to be one of those days? What mood is she going to be on, or he? Or it was a lot of wonder. It made things like a lot very stressful. Versus trying to focus just on patient care, I had to also worry about what's going to happen that day as far as working with someone. And the turnover that I actually, on my exit interview, I wrote front and back. I actually ran out of space on the things that could improve between staff training, because that was a lot of the big thing that I noticed. There was a lot of staff that were not trained properly. And I could tell that right off the bat, because I actually went to school, so seeing things being done that within the clinic itself, there was a lot of questionable things.
Mark.
To me, culture means you enjoy what you're doing. And it's very important to me. You've heard me say we look at things from the 10,000 foot level. That's not our job. Every administrator in that building will tell you that I don't pay very much attention to that rule. If somebody has a problem and they talk to me about that problem, I talk to the CEO because that's the person where it's supposed to go. And I also talk to the people who were there. Okay? I also use the hospital for my health care. We're still old-fashioned enough that we come into the hospital to pay our bill. So we see the people who are there. We see how they're treated. We see how they treat us. And if I'm not pleased with what I see, guarantee you there's comments made at the board meeting. Okay? There are times when I'm, Mark, settle down. That's not where we're supposed to be. But they come out. They do that. And I believe that that's where there's a lot of things that need fixed. And when you work with that many people together, you're going to have personality conflicts. You know, we all have a different reality to what we think should be right. And we need to find that balance. And I think a lot of our managers do a really good job. Some of our managers don't. We can't bring in. We try to promote from within in order to try to build that culture and show these people that we do think something of you. And are we perfect? No, there's a long way to go.
Thank you. Does anyone want 1 minute follow-up?
So real quick.
Okay.
So I've been involved in EMS over 20 plus years off and on, and running on the interstate with South Central. It breaks my heart when we pick up a patient and they say, don't take us to Rollins. I hate hearing that. It just breaks my heart. It hurts me because I know what our doctors do. I know what our nurses do. I know what their buy-in is. And we did a breakfast for many months, every morning, once a month for the employees, because I wanted to help that culture, to show them that I respect them and appreciate them. And this isn't to pat anybody on the back, it's to say thank you to those people. And that's what I believe in, is helping our hospital.
Thank you. Anyone else want 1 minute? Okay, so we received several questions that were aimed at like 1 or 2 of you specifically. So this next question has a little bit of a narrative, and I'm also asking it in a way that you all can still speak to it and answer it. So Rod, we're going to start with you, but let me give you the narrative and then the question. So we received several questions regarding candidates listed that have knowingly criticized, or in the words that were submitted, badmouthed the hospital in the very recent past. Specific names, Dr. Chu, Vanessa, and Mark, including concerns about conflict, additionally, including concerns about conflicts of interest for Dr. Chu and Vanessa being on the board, being former MHCC employees, and running or working at a clinic that could potentially be seen as competition. So the question is, for each of you that I mentioned, can you please share what is your criticism of the hospital? Why would you still run for the board if you have such criticism? And what is your end goal? For the other candidates, similar question, do you have any criticism of the hospital? What are those criticisms? And same thing, what's your end goal here? So I'll start with you.
It's a hard question.
Yeah.
Long question.
Yes.
We all got criticisms of the hospital, even though I've served on that board for a long period of time. There's issues. I know there's issues. Do I criticize them? At times during board meetings. There are some times when I'm critical. I do not criticize in a public forum, in a public way. I don't know how to answer the other questions other than to say that yes, if Dr. Chu is elected on the board, I will welcome and serve with her with open arms, and Vanessa. But there is some times when they're going to be conflicted, making some decisions for the hospital. With that said, thank you for showing interest in trying to help us become a better entity, and I appreciate that. I'm going to end it with that. I don't know how else to answer it. Thank you.
How much time do we have to list this?
So we're going to do
I'm
2
just
minutes.
kidding. Just-
I know.
I mean, I think, part of you've heard what I've spoken to, and I'm kind of glad actually that question came at the end when you've already heard. I'm very transparent about my views. I don't say something to somebody and then I go back somewhere else. I say something else. I'm very clear with where I stand on things, and I think I've made it clear why I would want to run for a seat on the board. I think a lot of where I've had some issues also with this is I don't understand why our clinic is competition. It should be, we want to all improve the healthcare of the county. And if that's done best by, I have my own separate clinic and people who don't want to go to MHCC come see me, and then people who don't want to see me go see an MHCC clinic, I don't know how that should be a bad competition. It should just be people have a choice. They can go wherever they feel like they feel the best connection and the best care that they're going to be given. And so a lot of things that when we're talking about these kind of conflicts, I mean, you kind of act like healthcare in a clinic is like secret. It's really not a secret. It's not that we have some secret tool that, we're using that the hospital doesn't. It's that, we treat our patients with respect. If somebody comes at 5, I don't want to send you to the emergency room to get treated for strep throat. I know Dr. Abels doesn't want to see you at 5 o'clock for strep throat when he's coding 3 people in the ER. I just feel like it's one of those that we could really work to build together a relationship that could really be beneficial for everybody. And I just think it's a disservice that a lot of the employees the hospital has done. I mean, I'll take health fairs for instance. I've never been told that you're starting to do health fairs, but yet then I get a call saying, hey, you're expected to get these results. And then I received a letter that one of my patients received from the hospital, pretty much lying about saying that I just flat out refused to receive any lab results. And I have the letter, so I mean, this wasn't something that somebody just told me and it was hearsay. She sent me the actual copy of the letter. These are things that really we should just kind of work to build a better community together.
Okay. Vanessa?
So I will say, when I first moved here, I had someone tell me, no, you don't want to work there because they're really that's not a place for you to work at. And I kept hearing all of these rumors and on, but I still gave it a chance. I was like, I still want to see what it's all about. I still gave it a chance. I still applied. I still worked there, and then I learned. And then it was a hard learn, but life-changing learning. But it was a good experience to see like the differences between the clinic itself and the other clinics I have worked at. Just seeing the differences, and I was like, I told the person, I was like, okay, I can see why you're coming at this. I can see why you're against it. But maybe there I can change it because I care. I'm there for the people, for healthcare. I'm there just to make you feel better. I'm there just to do your blood work. I am there for you. Regardless, if I am wherever I am, I'm there for you. Even now, I'm seeing competition that with Meadowlark Clinic and the hospital itself, there is no competition. Patients come in, if they like us, they stay. Sometimes there's no connections, they go over to the family practice clinic. We don't mind. We're like, okay, it's up to them at the end of the day, wherever they feel the connection. So it's really nothing about like, oh, one place is better than the other. There's really not. It's just the connection. Do people see which environment they like better? Yeah.
Thank you. Mark?
I guess if you're expecting me to lie to you and tell you that everything is peaches and cream, that isn't going to happen. And if it's bad mouthing to say our billing sucks, then hey, guilty as charged. Have I said it? Absolutely, because I know it. I know it's true. I know I'm working on fixing it. So if people are taking what I'm saying as bad mouthing, that means you're seeing my transparency. I am out there. I am listening to what people have to say, and I am doing something about what they say. I do bring those complaints back. I do try to do something with them, and I do try to make changes. That's why after 15, 16 years, I'm still trying to stay on this board because I still feel I can make a difference.
Thank you. And Mike?
All right, so for the person that asked and posed that question, I think that's a great question. It's valid. I think you have questions. I think that you want to know, why would somebody say this and then run for that same board? My answer to that would be because I want to fix it. And my personality is I'm a fixer. That's what I do in my business. That's what I do with things I get involved in. I can't fix your car. I can't even change my oil, but I really want the opportunity to try to fix stuff. If we don't come up with a solid business plan, if we don't change what we're doing, if we don't change direction, we'll be making the same decisions, just with more money. And that is a fail. And I don't plan on going there. Thanks.
Anyone want a 1 minute follow-up? No. Okay, next question. Dr. Chu, we'll start with you. This one's a little long too. So some residents have the impression that the current board isn't open to change except to address new services to generate revenue. Additionally, it's been rumored that the hospital has received offers from other healthcare entities, such as UC Health, to buy the hospital and clinics, and the board chose not to accept that offer. For current board members, is there any truth to that statement? For all candidates, would you be open to an affiliate or to sell to another hospital? What about changing the way the hospital looks or operates, even considering bankruptcy if the situation warrants, and then rebuilding from there?
Yeah, so absolutely. I mean, you have to kind of do whatever it takes to be able to run a functional hospital. So unfortunately, you know, if you have a tree and part of it's disease, you do have to cut away the disease part for the whole organization to survive. So very much so that I think, you know, having UC Health involved, having, you know, University of Utah involved, I think these would all be great aspects. Also, you know, these are places that are used to running smaller rural hospitals, and they understand, like, why do you have 13 admin members? You know, that's a huge expense, and there's not really much value that's being added. There would be a lot of benefits that they could really do. And so, yeah, I don't know the specifics on what organizations have offered to partner with us, but I know that, you know, whatever we're doing currently, it's not working. So I don't think throwing more money at the problem is going to all of a sudden solve it. So that's why I think talking to other organizations, having consulting firms, talking to other people, and really getting an idea, and honestly involving the community. I mean, you know, Dr. Young's patients, the ones who see him instead of the hospital, they're probably going to have a lot of input too on why they're seeing him and not the hospital. So I think it's, you know, going and asking those hard questions. Like, I mean, nobody likes being told why somebody's not choosing you, but that's sometimes a really important thing to understand to be able to be better prepared.
Thank you. Vanessa?
I do think so. So I do feel like if the opportunity came, so especially with how much financial debt the hospital is currently in, it would not be a bad idea. Especially since UC Health, they big organization, they have different clinics, different departments, and somehow they're functioning just fine. So why not? Why not bring their brains, their motives, their everything over and try to fix this place? Why not? Thank you.
Mark?
To say, we have actually, 3 months ago, we put out requests for proposals. Might be longer, might be 5 months, okay? The board decided to hold on that to really leave that option open to the new board that gets elected to do this. When the hospital district opportunity came up, that was a far better opportunity for the hospital at the time to do that. UC Health did not apply, weren't even interested. They said no thank you when they were sent a package for the proposal that was there. Banner Health said no thank you, we don't want to buy you. We're not interested. Okay, so unfortunately, unless you attend the board meetings and you hear these things, rumors fly everywhere, and life is full of rumors. But no, we've looked at change. We know there's a situation there. We've looked at what can we bring in, what can we do differently. When we did the RFPs 8 years ago, Intermountain Health wasn't interested. They says, you're too far. University of Utah says, you're too far out of our service area. You don't fit with us. And so these are all things that we haven't looked at these things, and we're not looking at change because we know as a board, and even the people who get elected here don't have the total expertise to run a hospital. And so you're going to need the outside help. And we've looked for this outside help. And we've left it open-ended so that when this board gets elected, they'll have that opportunity to decide, do they want a management company and who do they want?
Okay, thank you.
So, great question. Obviously, that if elected, I'm on board to try to make this hospital something special, something somewhere where it needs to be. if we can maintain the integrity of what we do well, I'm in 100%. If we can fight to keep our employees working and doing the things that they do well, let's make it happen. And if we can perhaps down the road offer services that are not available to the people right now, let's do what's better, what's the best for this community. Let's do what we can do to keep our people in this county and in this hospital. Thanks.
Mark answered it almost perfectly. The only thing I will reiterate, I'm not one to stand still. I know we have to change. We cannot survive where we are. This is not a survivable model going forward in today's healthcare entity. But we have to be careful, and we have to choose and pick the right entity to come in and help us affiliate, buy, however, or manage whatever we do. I'll give you a prime example of one that has went bad. Wyoming Medical Center in Casper sold to Banner. Those people are ungodly dissatisfied with the transition. What happened when Banner takes over those facilities? A third of your people are gone. Most of your nurses are gone. You have one hospitalist to take care of 100 patients. There's a lot of change going on. They are for profit, those organizations, and I don't want to see that. I will protect against that because I trust and I really appreciate our employees, and I want healthcare in Rawlins, Wyoming. I don't want to have to drive 200 miles to wherever it is to have a simple scope done of any kind. And so I will fight for that, but change has to happen, so, and I'm in, okay? So, yep.
I'm just gonna throw in a question here. All of you have great answers, but I spoke with the county clerk earlier today, and my understanding is if the hospital district passes, money won't start coming in until next, like October. We're looking like a year from now.
No, it's
So,
a year and a half from now.
Okay, year and a half from now. So maybe she was being generous with the time. So what happens between now and then if it does pass? I mean, really, can each of you speak to that? If you're elected, what are you looking at for that time?
Like, clarify that, please.
Well, the money just isn't gonna start coming right away. So what do you do between now and then? Eventually that money will start coming in and it will start helping the problems. Between now and then, what do you do?
Okay, can I start? Or do
Sure.
you want to start?
Go ahead.
Go ahead.
If I'm elected, I can tell you, being on the board right now, I know the plans we have in place to make significant changes. I know what we're looking at right now. We will continue in those plans, continue doing what we're doing with those things that we have planned. Is it perfect? No. But are we getting out of this hole? We are far better today than we were a month ago. Things are turning around. Our collections are turning around. We're getting that. Money's starting to come in. We're starting to right-size services. We finally have, in my opinion, we have a CEO in place, even though he's only temporary, because as I talked about, the contract's going to change in the next year. He's finally making the changes that are necessary in order to make us more profitable. Those things are happening. So if I'm elected, I already know what those changes are. I know where we're going. I will hold him accountable. I've known him for many years, so when he came in, I was excited about him. And I told him I'm going to hold him to a different standard than I held others because I don't have to learn him. I know him already. And that's what I would do. And what I would suggest to anyone who gets there, if you think you're going to get in there and just right the ship immediately, that's not going to happen.
Who else wants to? I mean, I'd like to hear from all of you if you have something to add.
Yeah.
So.
Go ahead.
So, I mean, that's a big concern. I mean, at any point, I've literally just been sitting there waiting to say, ooh, is today the day I hear from an announcement from the hospital that they're going bankrupt, and now all of a sudden there is no hospital. I mean, honestly, I think that's something that a lot of the residents are kind of waiting on like tenterhooks for, is just we don't know what's going on. We don't know if at some point the hospital is going to go belly up, and then what do we do? And so that's something that I think is a very real concern, is that it's not enough to just put all our eggs in one basket and say, hey, this is kind of where, this is our only plan and what we think we're going to be doing. And so I know that right now we have a temporary CEO, you guys have plans and whatnot, so do you guys have plans then for a permanent CEO or somebody that you're like currently grooming or training to be the new CEO within the next few months?
We certainly have options there. I will tell you that right now that we're looking at. I think that's some of the, if the hospital district passes, I think that's a decision the new board makes, what direction to go with the CEO. We are currently in the process of interviewing, as I said earlier, a permanent CFO, which we have been really created some issues not having that position filled for the last really many years with competent help. I shouldn't have said that, my apologies, but without the help that we really needed to move forward. We do have a plan in place. Certainly we have several plans in place that we're looking at keeping this open. We have discussed many options. I will tell you that. The board has been very active in this. We're not sitting still on this. I do not foresee the hospital closing. I believe we're going to work our way out of this. We are getting stronger. We've got the revenue cycle turned in a much better direction. It's taken a lot of work. And that's where we're sitting right now. It's unfortunate, all the times that I've sat on the board, we have approached these other entities to look at affiliations, to look at if they're interested in purchasing. And we're on an island right here. We are just such a small population. Right now, Carbon County has the smallest population base since 1960. There are right at, if not under, 15,000 people in the entire county. And so we're struggling with a population base. We don't have a lot of population, so she's flagging me, so I'm done. So thank you, my apologies for going.
Okay. Vanessa, did you want to speak to that?
Yeah, well, it makes it hard to plan for a year, especially with already the issues that's going on. But a lot of changes can be done by changes of services, the prices, the procedure, like prior auths, how that's done, the whole imaging, how that's done. That's gonna be a lot of income just right there. But also having providers seeing patients even more, like seeing more patients a day versus seeing just 10, 15 patients a day, seeing more. That's gonna help out a lot. Making sure that the billing, whoever does the prior auths actually does them correctly, appropriately, and in a timely manner. Because otherwise, patients doesn't wanna wait a week or two. So they'd rather go somewhere else where they're gonna get prior auth if needed that same day and get results that same day, if not the following day. So it just all kind of depends on the changes.
Mike?
Sure. You know, with respect, Mark and the board, there's going to be new people on this board. And I think for anybody to come in and say, well, there's already a plan in place that we need to go with that, I think that's irresponsible. I think for every new board member that comes on board, they all need to be in agreement unanimously that the direction that the board's going to take for this hospital is agreed upon. It's a great direction and it's the right choice. I think without looking at any of that, just to say that plan works, I don't think anybody can trust that. Not that they don't trust you, but they don't know what it is, and they're afraid. The people are afraid. They're afraid about coming to the hospital. They're afraid that it's going to be closed. They already can't get the services that they need. They have to drive 100 miles. They're afraid that the bill's not going to be all right. These people are concerned. We need to relieve those fears, fix that trust, and instill that back into all of us to make a difference for these people.
Anyone want a 1 minute follow-up on that one?
Nope.
Thank you. Thank you all for that. Okay, next question. Vanessa, we're going to start with you. Many of you have spoken about billing, but we also got a lot of questions about billing. I definitely understand there's a piece that maybe the board can speak on, maybe not, but let's just speak a little bit more. So there's been a lot of community discussion regarding billing at the hospital. There's concerns regarding timeliness, accurate records, receiving a final notice as a first notice, unexpectedly and inappropriately being turned into collections. The hospital put out a statement last week regarding changes and improvements that they're making in regard to patient billing. But as a board member, really, how have you or how can you help with the billing issues?
that is a tough question since it'll be more now of a fixing the system, like fixing how to approach to patients. Like I have been hearing, oh, the collections office just came over to the house and just to collect a debt that they didn't even know they had because they never been billed for several years now. So all of a sudden, a lot of that is happening, taking place. So with that alone, it's just hard. What was the rest of your question?
Really, as a board member, how can you help with the billing issues?
Okay, so with helping, again, it's more of the transparency. Like, here's the options. Here's how you can pay your bill. You can come in person. You can actually make it sure. You can pay it online. Here's the website. There is no clear website here. This is where you go. That is actually advertised everywhere, especially since the change of the EMR. Because before, whatever it was like the previous EMR, people knew, okay, you log in, make a portal. That was like, it was very well known at the time. But now with the new system, you don't hear it. How do you pay your bill? How do you do that? There's a lot of questions that, again, with the whole transparency, it would help if to guide the people. Like, hey, this is where you go, this is where, and it's gonna show like what it is for, statements, things like that, and that will help out a lot to making payment a lot easier.
How can a board member fix the many billing issues that are out there? Holding people accountable. That's the biggest way to do that. You have to hold people accountable. When you tell me about you can't do the online billing, you've already heard we come in and we pay our bill in person. We're that old fashioned. When I ask the people about this new system that just rolled out, they're telling me we rolled it out, we tested it, it works. I have to believe the people that are doing this. If I get a lot of complaints, then I'm going to come back to the people who told me that and say, hey, you lied to me. You have to hold people accountable. That's the big key to this. And then you have to keep people that stay. It's hard to hold the billing manager accountable when it's not the same billing manager it was last year. Now this new person has to learn things and do things. And that's probably our biggest problem. The turnover, it goes back to the culture, it goes back to the turnover. And many of these people just leave because a spouse got a new job and went somewhere else. It's not even they're leaving because of dissatisfaction. So if the billing problem was an easy fix, we'd have fixed it back in 2010 and the world would be happy. It's complex and we don't have that. The accountability is the problem, and most people just don't understand medical billing and what's there. And I'm sure I'll have further time to explain that in other questions.
Okay, Mike?
And I think you're right in the fact that most people don't understand the billing process. As a board member, every board member needs to understand from perception, from the initialization to the final collection, how that process works. From the very beginning to the end, what is that process? We need to understand what goes on, what the failures are, and what the successes are. We also need to have an open ear and listen to the people and understand what their problems and frustrations are so we can fix it. Because we can't fix anything if elected if we don't know what it is. In addition to that, send the people an itemized statement and bill, for gosh sake. They need to know what they're paying. They need to know what it is. If we can fix that and alleviate that, I think a lot of the problem's solved.
Well, it's an issue, and it always has been since the day I sat on the board, and that's why we converted to Cerner to try to fix this problem. And we are getting there, and I do think it will be a better entity down the road. But billing and rev cycle is complicated. There are actually 8 different processes in the end-to-end rev cycle that you go through. But when you when you walk in the front door till the time the hospital gets paid, there's 8 different processes that your bill has to go through. And so and all of those have to mesh. They all have to talk to each other. If you've got a hiccup with any of them in the middle, then, they sit there in a pool, in a pod, until somebody figures out, oh, we need to go look at that. We need to go pull those. And if you don't have the people that are doing one part of it, talking to the people that are doing the other part of it, you've got issues, you know, and it slows things down. And so hopefully we have got that now to a point, after a lot of work, to where it's going to be very beneficial and very smooth. And I can tell you the employees are just as hard on the board members as far as getting this right as a lot of the patients are, because they're doing the work, they're doing the extra work, which they shouldn't be having to do. They should be doing their job as being nurses or whatever it is, you know, so I'm flagged again, I'm done.
Thank you.
Go ahead,
Thank you.
Steph, I'm sorry.
Yeah, so one of the billing issues is that, you know, our billers that we use, so they take a higher percentage, but, you know, if you save 4%, 4% is zero, you're not saving money. So, I mean, ultimately, in the end, you need to not look at a discount outfit. I mean, people who charge higher, sometimes they just charge higher because they're charlatans. Other times it's because they do good work and they know that they're worth it because they're spending that extra time. So I think that's a huge part of it. Also, you know, I think it's a very real problem that happened to me where I got called and told you owe this bill. I marched down to the CFO's office because I worked at the hospital. I said, somebody's trying to scam all your patients. They said, oh no, that's our people. And I said, I've never even received a bill. Like, how am I getting a phone call telling me I owe money? And it was because they billed it incorrectly. I had to, in the end, because I gave them the number, gave them the form, they didn't fill it out, I had to fill it out myself. Most patients can't do that. Most patients don't know what their codes are, don't know that for OB services, it's a global service, so they shouldn't have to pay per visit. So a lot of people don't have that information. And one thing I would just kind of let the residents of Carbon County be aware, because recently I became aware that several patients were actually served notices that they were being sued from MHCC to collect on unpaid bills. One of them had no idea she owed any money. She had insurance the entire time. And so one thing to be aware of is that even if, like, let's say I go in and I deliver a baby and 3 years later found out they never billed my insurance company, it's not their responsibility. They can still come after me, and not just for the amount that the insurance company would have contracted. They can come after me for the entire amount that they billed. So let's say they decided the bill was $50,000, which they have no obligation to have any discount or anything. They could come after me for all $50,000 even though they never billed my insurance. So my question earlier is that 3 years later, a lot of insurance companies won't pay a claim that's that old because the hospital forgot to bill it. So are you going to say, yes, we're going to write off those amounts if we should have billed insurance, we didn't, and now we have a $23,000 bill that is unpaid? I think that's something that all the residents should be very aware of and very worried about.
Thank you. Anyone want a 1 minute follow-up on that one? No? Oh, go.
Excuse me. Just one thing to reiterate on that, and there's problems, and I agree, Dr. Chu, but maybe the hospital didn't know. Maybe the patient did not inform the hospital that they had insurance. So that's also a possibility. So, thank you.
Thanks. Okay. We've talked a little bit about the administration at the hospital. I think this question is directly probably referencing CEO, CFO, but Mark, we'll start with you on this one. MHCC has contracted with QHR, formerly known as Resolution RCM, now known as Amplify RCM, for many years. In this person's experience, they've not been a strong business partner and have contributed to the lack of management support and the ever-revolving door of administration. What plans are in place, or what can you do as a board member to either get the expected return on investment or replace or eliminate the need for them?
First, whoever put the question in has all the agencies wrong. Okay, QHR is currently called Ovation. Ovation is the management firm, and that's who our current CFO is, or CEO is employed by. Okay, that's also, we have a consulting contract with them. We didn't get into a management contract because years ago, when QHR, because they change names every 3 years, I think. When QHR was the management firm and they were responsible for it, we were in the black. We were in the black up until the time that we had to go out and hire our own CEO and CFO. When we had that oversight, we were operating correctly. Was everything perfect? Absolutely not. It will never be perfect. But some of those other firms, one of those is the current, Rod referred to them as, they're part of the revenue cycle. So they're not the management firm. So unfortunately, and we hold every one of those accountable. Every one of those entities report to the board at a board meeting to tell us where they're at, what are they fixing, and many of the conversations with them are not pleasant because we know we have troubles and we know they're the reason for the troubles.
Okay, thank you.
One more time?
Okay, so the question is, the hospital is contracted with QHR. I won't do all the acronyms, but we'll say QHR, I don't know if that's correct, for many years. In my experience, they've not been a strong business partner and have contributed to the lack of management support and ever revolving door of administration. What plans are in place to either get the expected return on investment or replace or eliminate the need for them?
Understood. So I think the questioner has insight that says that they have not been successful, this management company, and I would attest that that's probably true. I would say that the recent history proves that. And if elected, and I would say one of the first things that needs to be done, in addition to evaluating everything, is to bring that management company to the floor and express what is happening, where we're at, and that our concerns are, and then look abroad to see what is available to us. Once again, what do they bring to the table? What do they offer us? Is it something that's important? Is it something that's doable, viable, and productive for this hospital? Is there other options out there? Because we need to find it and get it right until it's fixed.
Thank you. Rob?
Thank you. Currently Ovation, that was formerly QHR. I will tell you they were a very successful management partner of MHCC when they were allowed to be a management partner. We had a disagreement with the county commissioners, and they did not like our choice of management. And I can go into the politics, but I will refrain from doing that at this time. So we had to revert to a consulting contract with them. So once we went to a consulting contract, they did not have the direct oversight of the CEO and the CFO. I'll give you a little prime example. When a CFO walks into our board meeting and he gives us all the financials, I mean, it's extensive. I have to trust him. I don't know if they're right or wrong. I don't know what he's telling me. But those management companies, they do. They know. That's their job. Same things with CEOs. And so they were very successful when they were a management company. I can tell you the last 6 months, maybe 8 months, we have been on them ungodly hard. We are getting our bang for the buck in a better way now than we have been in the past. They have stepped up to the plate, and they needed to step up to the plate. One of the first things the new board, if it goes forward and if the hospital district is passed, they're going to have to decide what direction they want to go. We decided to just honor them and give them a 1-year contract, so this new board, if all this passes, has a chance to get their feet on the ground and then decide what direction to go in the hospital. Thank you.
So I don't know a lot about Quorum, if that's the name now, is Quorum?
Ovation.
Ovation, sorry. I knew them as Quorum before, so
Yep.
I don't know a lot about Quorum or Ovation, but I just have known what I've heard, which is that they used to manage Laramie and that they pretty much ran that place into the ground. They got out of Dodge once they kind of sucked that hospital dry, and then UC Health came and kind of built it up. And I've not been in the Laramie Hospital, but I've heard that it's a very nice facility. So I do think that, new management would be important. I also think it's important to pick, leadership, not a CEO who doesn't have the credentials, who doesn't have, a good relationship with the rest of the hospital, but, is really good friends with 1 or 2 people who are really important and in charge. So these are things that I feel like unfortunately happen over and over in the hospital. And instead of picking people who we say, hey, let's look at your qualifications. how many hospitals have you managed, you know, and if you've not managed a hospital, what leadership position have you been at where you're intimately knowledgeable about these things? I think it's just kind of like, you know, when we talk about people with bad pickers, you know, if you have a bad picker, you pick someone who's not great, like it's not a surprise it doesn't succeed, but also you're going to keep making that same decision, which is why I think you need to have broader input than maybe, you know, a few people who what they value is maybe not what the rest of the hospital values. So I feel like getting your employee value input would be very valuable, because there's a lot of things that, you know, like they're not going to act a certain way towards somebody who they're trying to, you know, get in good with, but somebody who they feel like is kind of below them, they're going to kind of stomp on them, and those are the people you need to listen to. And of course, take everything with a grain of salt. I do too. People come in with complaints, and you have to kind of listen to it and figure out where you're at, but you also have to listen to if there's an overwhelming theme and multiple people are saying the same thing.
Thank you. Vanessa?
So I don't know anything about the companies themselves. I just know when I'm looking at something, I look at the research, I look at the data, I look at the facts, I look at like reviews as well. I look at all of that, and then I make a decision at that point. So it's just, if there's options, looking one place to another, just having things to combine, to compare, having the comparisons, it's good. It would help out a lot. But yeah, I think just doing the whole research would help a lot.
Okay, thank you. Okay, I'm going to stop with our questions here, but I know we have a lot of hospital employees and former employees here. Is there one of you that maybe has a question that we haven't touched on? I'd like to hear if there is one, and a question from an employee, now that we have all of the candidates in front of us. If you have one. Okay.
I would like to know how many travel nurses the hospital is currently employing.
Great question.
That is a great question. I can't answer that exactly, but I can tell you it's probably around 6. Go ahead.
Have our HR
Yep,
director here.
okay, HR's right there. She can answer that for
Right
you.
now, it is 8 travel private contract and then 2 that are non-nursing.
So 10, 8 to 10. I just want to make sure that the community is aware that travel nurses get paid an extensive amount, upwards of $10,000 to $13,000 a month. And it is a problem because we're not investing in our community nurses, the nurses that are here, that are vested in the community, that are part of the community and would love to have that opportunity, and they're not getting that same respect or care from the hospital as they would the travel nurses. And it's also very important to realize that these are hundreds of thousands of dollars that are getting expended to these travel nurses, and we really need to find a way to shift that into our community nurses and find a way to work with them and improve morale within the hospital. And I know this is a huge problem with morale within the hospital as well, because you've got these nurses that are working in the hospital for 20 plus years, and they're getting paid minimal amount compared to the travel nurses. And I don't know if it's true or not, but I was also told that they get free housing provided by the hospital, which again is just another slap in the face to the community nurses. And so these are some of the things that really need to change.
Do any of you care to speak to that? Would like to
You
speak
want
to
me to
that?
address it? Do you want to handle it?
Go ahead, I'll let you and I'll
Let's
do
just
it.
go
I'll just jump on that. We know that. I mean, do we want travelers? No. We want full-time RNs in our hospital that are members of the community. There is a mega shortage of RNs right now currently in the nation. We would love to hire, another 6, 8, 10 tomorrow if we could. We are all over that, but they're just not available. And recruiting to Rawlins, Wyoming is ungodly difficult. So yes, travelers are very, very expensive. I would love if we could get away from that. Mark, go ahead.
Trust me.
Actually, we'll just go
Oh,
down.
okay.
Yeah.
Okay, so I mean.
I'm sorry.
Oh, that's okay. So you said they're not available, but there's one right there who used to work at the hospital and, you know, I mean, so it's things like this that we need to delve into, well, why did you leave? And I mean, we had touched base on it a little bit because we had had some of these conversations, and unfortunately, a lot of what happened with when the OB department closed was there was no buy-in from the OB nurses to say, hey, you know, we want to keep you, you're so valuable. Can you come and work med-surg? Can you, you know, retrain? It was just we just assumed they're going to do it. And they were like, no, thank you. That's not in my plan. So, I mean, I know that because I talked to a lot of the nurses. And so I feel like a lot of these things can be solved by having some of those conversations. And I mean, I know that at some of the county commissioner meetings, I was told how, well, having a traveler actually saves us money because we don't have to pay benefits. Well, that's not true though. Number one, a lot of people, they don't even get benefits from the hospital, they'll get it from their spouse. Number two, also when you have a traveler, they're guaranteed hours. So this isn't, when we're talking about travel nurses, this is not like, you know, if you have somebody else who comes and works for you PRN, and if you don't have enough work, you put them, you know, like send them home. Travel nurses, they're guaranteed that pay. So whether or not you have patients, so you could have 5 travel nurses who sit around one patient versus if it's somebody, maybe, you know, Claudia wants to go see her son's like, you know, baseball game. And so she's like, hey, yeah, you're kind of slow. Can I take off and go do that? There's a lot more flex with it. So, I mean, I think, yeah, recruiting is hard, but it's also then of the people we have, what do you need that you're going to stay here and you're going to actually want to come be part of our community?
Good question. Thank you.
Vanessa?
So, from what I've been hearing as well from a lot of the nurses is they don't feel like they belong, some of them. They don't feel like they're actually like, oh, that the hospital actually wants them present. They feel disqualified, they feel discouraged. And along with it comes with the pay, because they feel discouraged. Well, travel nurses are paying much more. What am I gonna do here now? I'm not guaranteed all the hours. They're here, they're gonna take my spot, and then they fear that eventually they might end up moving here, and then now they're jobless. So it's a lot of concerns there right off the bat. It's just hard. Yes, we're a small community, we're not that big, so resources are limited, but the ones that we do have, we just need to cherish them even more, care for them even more.
Thank you.
When we closed the OB unit, I was assured every one of those nurses were offered a position in the hospital. Most of them turned it down because to be an OB nurse is very specific training. And they didn't want to give up that training. They wanted to take that training and go to other places where they could use those skills. So if I was not told the truth, I have no way to correct that. Okay? I know some of them stayed. Some of them took other positions, and they're here and doing quite well at their other positions. So we always hear the negative things, or the one person blows it up to it was 15 people. Okay? The fact is, I was told everyone was offered. The ones that wanted to stay, stayed. The ones that didn't moved on because they wanted to stay within OB, and I accept that. I'm also told, and I was beat up seriously by nurses when I said a nurse is a nurse. A nurse is not a nurse. A nurse is very specific in their training. They train in this area, they do this area, and they do this area very well. So I learned that the hard way because I opened my mouth and I got told quickly how that is. So if there are nurses that are out there, I would ask you, please apply to the hospital. Come up there and speak with Amy. She'll be happy to tell you that I see the sheet every day, every week. I see the openings that are there. If there's nursing openings there, come up to the hospital, see what they are, see if you qualify for them, see what happens.
Thank you. And Mike?
Ms. Claudia, I respect your question and your comments. I think that really came from the heart. I know it was probably hard to get out, and it means a lot. And I completely understand where you and many would be coming from. And I promise you, if elected, that I will listen to you. I will understand all those needs, especially the differentiation in the wages, with the culture, with the toxic workplace, with the bad morale. I promise I will listen, and I will open that for any person that is employed or has concern with this hospital. Thank you for that.
Oh, go ahead. 1 minute.
Okay, so besides naming the OB director, the nurse who was OB director, can you name another OB nurse who was at the hospital?
Can I know?
Okay. And so, I mean, I think it just kind of speaks more to my point that you're saying, you know, we blew this out of proportion. A lot of the nurses stayed. Most of them left, in fact, and I can off the top of my head list, you know, multiple of them because I worked with them. I was in the trenches with them. We were the ones who were there, you know, like taking care of the babies, you know. I was the one checking in with them and also made it a point to talk to them. And I feel like that's a big part about this information is that you get told something, if it doesn't pass the smell test, you know, trust, but also verify. You know, say, okay, that's interesting, you know, like that sounds odd, and then you talk to people. And if they say, no, that's not what happened at all, then, you know, you need to delve a little deeper into it and dig in and see where the issues are.
And I'm being told 4 of them stayed.
Okay, we're gonna go ahead and wrap up. So I'm gonna allow you 2 minutes for closing. Anything you wanna share, feel free to do that. And Mike, we're gonna start with you and we're gonna work backwards this time.
Well, thank you. I can attest that my friend Brittany was a great OB nurse. How do we get the perception to meet experience? Perception has been there for this hospital for a long, long time. Every time that we don't get it right, it just builds on that perception and it makes it worse and it just encourages that perception. From the first experience of greeting our patients to the itemized billing and a good process for people that have no insurance and how to pay their bills so we can get paid and so they can pay in dignity. We need to save this hospital. We need to make it more efficient. We need to make this a hospital that is in a business of compassionate care. My phone number is 321-MIKE. I encourage you to call me, text me, reach out to me because I want to listen to what you have to say. Thank you.
Thank you. And Mark.
Thank you for attending tonight, showing up, those of you online. Thank you for taking the interest in doing this. I've been the longest serving board member there, and I have tried to solve some of these problems since the day I got there. If the answers were easy, we'd have them solved. No one can ever say they've come to me and I ignored their problem. If they're saying that, they're just not being honest, because I have created more problems by getting involved than probably sometimes I should have just left it alone and it would have fixed itself. Much like Mike said earlier, I'm a fixer. I've been a fixer my entire life, and I will continue to do that as I move forward. If I am fortunate enough to be elected, if you place your trust in me, I promise you I will do all that I can to continue that we have a hospital in Carbon County and that it is a good, providing, good place to work hospital. Thank you.
Vanessa?
I just want to say thank you, everyone. And I just wanted to re-clarify again, there is no issues with, as far as me working with the clinic at Meadowlark, being a so-called competition with the hospital when we're not a competition. I'm just there just to help with the people. I am just here for the people. I fell in love with Rollins. That's why I haven't left. And I'm still planning and still living here because I fell in love with Rollins, the community, the people. Everyone is very nice. And as long as there's communication, that's really the key to everything. That's gonna help out a lot. More with transparency. So, yeah, it's kind of hard to say because, like, I don't know, I'm getting emotional because I really fell in love with Rollins, like the people, like just being able to go to work and just be like, oh, I'm gonna do your blood work. Oh, we're talk about this, even though we're there for like their medical needs. I'm also there to listen. I listen to a lot of the stories, a lot of this. My ears are always open. Like there's a lot of communication in between my own patients and there's just a lot of communications, a lot of love and compassion there. And like I said, I'm just here for the people. There's really no competition. nothing at all. I'm just here for the people.
Thank you.
Yes, so I think, we've kind of touched on a lot of different topics today, and, it's really comes down to, I just really think a lot of the issues that we're facing right now come from the mismanagement and not necessarily, something that's going to be fixed by a hospital district and having more money that, we throw at the problem. So in the end, I really think it's something that I personally won't be voting to yes for supporting the hospital district. I'm going to vote against the formation of it. And then in the end though, if it is something where it does go forward, I would want to make sure that there's more oversight. And that's why I think it's important to have other people kind of be involved and be aware and just kind of get, kind of into trying to fix the hospital and improve it. And unfortunately, maybe this is kind of the cold hard shock to try to be like, hey, whatever we're doing isn't working and we really need to turn things around.
Thank you.
Okay, well, first, thank you all for the interest in MHCC, all the people online, and thank you for having this forum. It's greatly appreciated. Continue to go forward. Failure is not an option for this hospital, period. We're going to make this thing work, and we're going to right size it. We're going to get it to where it needs to be, where it's going to be successful again, where it was not very long ago. Okay, we can get back there. I will give it 110%, as I have for the last 10 years. And please support the hospital district. It's not going to solve everything, but it's certainly going to help things going forward for future generations. Thank you.
Thank you. Okay, once again, thanks to all of you. Thanks for coming in person. Thanks to all of you online. Thanks for submitting the questions. If you have additional questions for the candidates, please do reach out to them. And really thanks to all of you. Each of you are to be commended. I know how difficult it is to put yourself out there as a candidate and be facing, all these questions like this too. Sounds like it's been a tough road, and it sounds like it's going to continue to be a difficult road, but thanks to each of you. And if we could give them a round of applause. And please vote.
Please vote.
November 5th, or you can vote now, actually, absentee. Thank you. Thank